So welcome to everybody. My name is Samir Vora. I am the founding chair of the Department of Population Science and Policy at SIU School of Medicine, and I want to welcome you to our final Rural Health Summit webinar, Transforming the Health of Rural Illinois, a blueprint for investment and action. For those that have joined us on previous webinars, you know that this is the 9th of 9 webinars where we have dived deep into the issues affecting the health of our rural residents and rural communities, and have featured a number of innovative individuals and programs that are working to achieve and improve the health of our rural communities. The work of the Rural Health Summit actually started in 2018. And at that time, the SIU School of Medicine Department of Population Science and Policy, the University of Illinois at Chicago School of Public Health, the SIU Medicine Center for Rural Health and Social Service Development, and the SIU Paul Simon Public Policy Institute joined forces with IDPH to host the first Rural Health Summit in 15 years, since 2003, when the late, great Senator Paul Simon convened actors and important decision makers in rural health to create a series of policy recommendations to make sure that we could improve our rural communities. In 2018, we convened to think of a new blueprint where we invited healthcare leaders, public health leaders, philanthropists, academic, community leaders, payers, to really think through not just specific health issues, but also social and structural factors that affect health. That led to an innovative day-and-a-half series with a set of policy recommendations that were worked on throughout 2019. And as we were set to unveil those recommendations in March 2020, we all know what happened. The COVID-19 pandemic hit, affecting that story and sort of creating a new one, a new set of challenges that our rural communities faced. So this group came back together starting in late 2020 to host a series of discussion forums that dealt with a number of different issues. During those final 6 months of 2020, 80 leaders from 55 different organizations convened to talk about challenges that affected an aging population, mental health, public health systems, nutrition and fitness, children's growth and development, rural health workforce, opioids, healthy housing, and economic development. So starting in March of 2021, the group came out with their first brief and set of recommendations titled Building a Healthier Rural Illinois, Understanding and Addressing the Challenges of COVID-19. What followed were 8 additional policy briefs, starting from April 2021 to December 2021, that dove deeper and provided 3 recommendations on each of the topic areas that we discussed. April took us through aging, May, mental health, July, public health systems, August, nutrition and fitness, September, children's growth and development, October, rural health workforce, November, the rural opioid epidemic, and December, rural housing and homelessness. So today we come to you with a compilation of all of those ideas, summarizing them and thinking about, one, understanding what we learned over those 8 previous briefs and webinars on how we can move forward, how we can create an appropriate blueprint for investment and action. And in doing that, we wanted to bring representatives from those sponsoring organizations. And we have the real treat of having a very guest and special moderator for this final webinar. So it's my honor to introduce Lieutenant Governor Juliana Stratton, who will be our special moderator for this final webinar. Juliana Stratton is the first Black woman to serve as Illinois' Lieutenant Governor. In addition to spearheading the administration's Justice, Equity, and Opportunity Initiative, Lieutenant Governor Stratton also heads more than a dozen councils, commissions, boards, and agencies as chair or executive liaison. She has received numerous awards and accolades for her commitment to public service and social justice advocacy, including being named one of the 50 most powerful women in Chicago. I've had the great honor of knowing the Lieutenant Governor for nearly 6 years and have known her as a great champion for all issues across Illinois, but especially those issues affecting the rural health of our great state. So I'm going to pass it along to Lieutenant Governor Stratton, who will begin our session and introduce our panelists.
Good afternoon, everyone. I am Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you so much to my good friend, Dr. Vora, for that warm introduction and for the incredible work that you and the entire team at SIU School of Medicine do to uplift Illinois' rural communities. It's such an honor to join you all for the final webinar of this series. Now, we are joined by 3 distinguished panelists, all of whom have a proven track record of pushing forward efforts for health equity. As you just heard, Dr. Samir Vora is the founding chair of the SIU School of Medicine's Department of Population Science and Policy, which aims to improve health outcomes in central and southern Illinois. Dr. Vora has received several honors for his work, most recently in 2020 being named a Presidential Leadership Scholar chosen by the George W. Bush Presidential Center, the Clinton Presidential Center, the George and Barbara Bush Foundation, the LBJ Foundation. Now, Dr. Linda Baker has been a university professor at the Paul Simon Public Policy Institute since 2003, where she focuses on expanding access to high-quality healthcare in partnership with the SIU School of Medicine and helping communities of color and people with disabilities realize their potential. Previously, Dr. Baker held several state agency positions. She served as director of the Department of Employment Security, assistant director of the Department of Public Aid, and Dr. Baker served as the first African-American legislative liaison for an Illinois governor and stepped down as secretary of the Illinois Department of Human Services to join the Institute. Now, finally, we're also joined by Dr. Wayne Giles, Dean of the School of Public Health at the University of Illinois at Chicago. Before coming to UIC in 2017, Dr. Giles was the director of the Division for Heart Disease and Stroke Prevention at the CDC, and he also led the Division of Population Health at the agency, one of the CDC's most diverse divisions, working on community health promotion, healthcare utilization, racial and ethnic disparities in health, and much more. I just want to take this moment to thank all of our panelists for taking time out of your busy schedules to share your wisdom and expertise. And I'm so excited to learn more about how we can better serve rural Illinois residents. So I'm going to jump to my first question for Dr. Vora. When we think about these topics from a 10,000-foot view, I would like to ask, how do you really see that COVID has impacted the health of rural communities in Illinois? And specifically, I'd love it if you could dig into more deeply what kinds of challenges are specifically unique to our rural communities.
Thanks so much, Lieutenant Governor Stratton. And as we have sort of worked through and talked and seen and visited leaders across rural Illinois, we know that COVID-19 has been a challenging time. It's been a challenging time for all of us, but part of not having often the infrastructure and capacity that we can see in our bigger cities, rural communities have had to often think differently, think creatively, find unique partnerships that would allow them to not just address the challenges of COVID-19 from a health perspective, but also how that challenges around health affected other social services and other issues. First and foremost, I think just amazed about some of those innovative practices and the new types of innovations that were formed. But as we have gone through and thought about well, how do we encapsulate what's been going on in our rural communities during COVID? We've described this as the 5Ds. So we know first and foremost that rural communities often start at a disadvantage. Rural communities and residents in rural communities, they struggle more than urban communities from the 5 leading causes of death. Those being cardiovascular disease, obesity, stroke, unintentional injuries, and suicides. We also know that this advantage is often really created from 2 different elements. The first of those elements is deserts. There's often a desert of essential services in rural communities. For example, just the idea that 80 of 102 counties in Illinois don't have a child or adolescent psychiatrist. We know those deserts are true in terms of so many issues, from grocery stores and public health workers to childcare centers. But those deserts are sometimes magnified because of disconnection. And we saw that so profoundly during the early elements when all of us had to morph into, instead of meeting in person, to meeting in virtual forums like this. And although the governor's office has made such an important investment in broadband across the state, we know that there are still areas that just don't have high-speed services that affected work, that affected social interactions, and effective education. And that disconnection from one aspect around technology, but also in the way that sometimes our services just are siloed and are not able to work together because of the funding structures that are put into place. And that creates disparities or inequities. And one of the most meaningful parts of our Rural Health Summit work, we're having relationships and partnerships with individuals both in rural communities and in our most vulnerable communities in urban areas. And we spoke of similar disparities that affected both of those entities. And that leads to often disadvantage, that because some of the unique funding streams outside of government just aren't available in our rural communities, such as philanthropy, corporate investment, rural communities have to think differently in terms of how they work through and think about advantage and how we can create more development opportunities to help those rural communities thrive.
Thank you so much. And I really appreciate what you talked about. We talk about broadband access, but the idea of connection is much deeper than that. Yes, that's one part of it. But when you talk about the deserts, we are seeing all of these disparities are interrelated, but these systems aren't often interrelated due to the lack of connection or distance or geographic kind of scarcity in many of our rural communities. I just want to confirm that Dr. Giles is still on the line. I don't see his camera. There he is. And I just wanted to see, thank you, Dr. Giles, if you wanted to chime in at all on that question. Dr. Vora talked about just rural communities often starting at a disadvantage, and the deserts of essential services and that disconnection and not always having the same sort of stream of resources. What would you say in response to the question of how COVID has impacted the health of rural communities and any of the challenges that are also very unique to our rural communities?
Yeah, thank you for the really important question. And I think there are a couple of things that I would say. I want to pick up on this commonality between rural communities and urban communities that Dr. Vohar talked about. But before I do that, I do want to just spend a minute just chatting about this partnership that we have. And I think having SIU and the Paul Simon Public Policy Institute and us at the University of Illinois Chicago coming together has just been a fantastic opportunity for us to improve the health of residents in rural communities. I think it's also, this started, as Dr. Bohar mentioned, in 2018, and it's great to see sort of how this has sort of all expanded over that period of time. As the only public school of public health in the state, we have deep, deep roots in Chicago and in Cook County. So in many ways, I think this question about commonality between urban and rural really resonates with us as well. We also have a strong focus on health equity and community engagement. I'm going to come back to this topic of community engagement in just a minute. We also have one of the most diverse schools of public health in the nation, and I think that's something the state of Illinois should be really proud of. 60% of our students come from Illinois, and they end up working at the Illinois Department of Public Health and in local health departments throughout the state. When you think about metropolitan areas in aggregate, we tend to think that they have better health, and in reality, they do have better outcomes, health outcomes, than rural communities. And that's well documented, and we know that. And that's true for conditions like COVID. It's true for a number of chronic conditions, mental health, suicide, etc. However, what's missing from that really important analysis is the large variation in health outcomes that we can see in communities, and the really important need of having a much more what I would call hyper-local approach as we think about this. So whether we look at data and information at the census tract, zip code, community level, etc. And when you begin to look at those issues in that way, what we find is this commonality of what we see in urban inner city communities, Black and brown communities, and what we also see in rural communities across the country, or rather in the state of Illinois. And so whether we're looking at life expectancy or mortality from heart disease and cancer, or mortality from COVID that you all were talking about, or clinical preventive services, we see the same things over and over and over again. And that commonality is, I think, really important. But I think the other thing that I think we need to be thinking about is those commonalities, not just in health outcomes, but also in infrastructure. And so Dr. Bohar talked about deserts. He talked about food deserts, right? We see those in urban communities and in rural communities as well. We can think about pharmacy deserts as well, and sort of delivery of vaccinations as part of that, but also things like broadband coverage, and that, right, and differences in sort of, we do see pockets where that's important. But I think that this also provides a really nice opportunity for us to think about how we can bring coalitions together. And so I want to spend a few minutes talking about that, and particularly thinking about sort of how we bring coalitions together to invest in communities as we're beginning to think after COVID and sort of what that might look like. And while the disparities may be similar in urban and rural communities, I would argue the solutions are going to be very, very different. And I think we got to think about sort of how that might happen. And so, for example, if we think about vaccine hesitancy and what all that might look like that those issues may be very, very different. Transportation issues, being able to navigate websites, etc. All of those things may be very, very different. Also, we frequently talk about in public health and others, what are the trusted messengers as we're delivering our interventions. I would argue those trusted messengers are going to be really, really different as we move forward. So again, thinking about all of that is different. The last comment that I will make on this topic, and then we can move on, is we also need to think about sort of how do we bring together a broader coalition? And what does that look like? And I think one of the things I loved about the first summit was we put together a coalition that included academic institutions, community-based organizations, elected officials, et cetera. And I think, and community organizations, and bringing those groups together is extremely powerful. And that hyper-local approach can be really powerful as we move forward. So thank you for the question.
Well, thank you, Dr. Giles. And I think that, what you talked about with the coalition building is such a critical piece, because I think from a policymaking standpoint, there's often been this sort of bifurcation of what are urban issues and what are rural issues. And actually, when you look at that, and that's sort of, having grown up on the south side of Chicago, now chairing the Governor's Rural Affairs Council, I constantly have the statement that these are the same issues. But what was important about what you said is that the solutions may be different. And so we have to make sure that those voices are at the table to say, from a credible messenger standpoint, from the perspective of the community, here's what needs to happen. Now, I can't tell if Dr. Baker is having some technical difficulties. I do not see her, so I'm going to keep going with the second question. And then Dr. Baker, when I see your face, if you come on back on or unmute yourself, then I'll know that we can go to you too. So the nature of life in a rural community often leads to challenges. We just talked about some of those challenges, but that can be in geography, a lack of a workforce, and hard to find or non-existent data. And if we talk about all of these issues in policy making, data is such a critical component. How can state, local, and private industry really work together to overcome these challenges and improve these deserts of service that you talked about, Dr. Vora? And one of the things that I just want to say about that is, you talked about how, for example, philanthropy and some of the other resources aren't often in our rural communities. So when you think about state, local, and private industry working together, what can we do to overcome these challenges? But also, what needs to happen? What are the solutions to make sure that all of these entities are being laser focused on needing to address these issues in our rural communities? And Dr. Giles, would you like to take this question first?
Sure, I can start off, and then Dr. Baker can add. I think as we think about data, and I'm going to go back to something that I talked about earlier, is I think we need to get at a lower level. And I think we need to sort of think about sort of how we can get sort of much more hyper local in terms of some of the data that are needed. And so and I think COVID has taught us, and I think folks at the health department and others have been great in terms of being much more quicker and rapid in turning around data, right? We're all sort of going to the COVID dashboard almost on a daily basis to see that. And that data transparency, I think, is really important. And I should say, I'm an epidemiologist by training, so I always go to data first. But I think having that hyper local data, having that transparency is really important as well. I think, one of the things that Tip O'Neill, when he was Speaker of the House, used to say is that all politics are local. And I really do think that when we think about these health issues, it's all local, right? I frequently say all public health is local as well. And so I think because people can see when it's their own data, their own community, it resonates more with them. So I think that's number one. I think that also helps with businesses and with philanthropy and other groups as well. I think when they see this hyper local, this is the impact that's happening in the communities, this is the change that is happening, that can be really valuable. I think it helps to make the case. I think part of what we have to do is we need to be empowering communities so that they understand their information, they understand what to do. And that, to me, is the value of these coalitions, is bringing them together, is because I think there's also a lot of expertise in communities as well. And so when we lift up that voice, we can see really powerful change.
Absolutely. We have to be transparent with the data, but it has to be accessible. And what you talked about in terms of communities being empowered to understand the data, first they need to know what's being collected, and they need to know that they are, being included in that data collection. because that is very powerful. Dr. Baker, good to see you. I think you had some technical difficulties, but you're just in time because I was asking the question about sort of the challenges that we often see in our rural communities, like the lack of workforce, challenges that are related to geography and kind of like either hard to find, incomplete, or non-existent data, and just wondering your thoughts on how states, other local governments, private industry can really work together to overcome some of these challenges so that we really can do what this whole forum is about: improve deserts of service to make sure people are getting their needs met. And I think you may be on mute.
Good afternoon. Yes, the technology is, when it works, it's great. And thank you. Leading up to this question, as I think about connectivity and deserts, when we look at broadband, one of my technical issues this afternoon was connectivity. And so for those individuals in that sit in rural areas and sit in areas like I'm sitting in today, where oftentimes broadband is not a reality, or it is slow, internet systems are slow. And so those kinds of things, being able to connect people with the outside, the whole notion of bringing in telehealth and telemedicine, letting individual doctors and nurses from various different areas across the country come into those rural areas and bring their expertise. Commitment and collaboration, state and local governments collaborating with people at the local level. Oftentimes when you sit around a table, and we have been doing these forums, you hear from people in rural areas. They bring their information, and oftentimes it's very different than what we hear in the city of Chicago, or even in Springfield for that matter. So being able to connect with those individuals. Transportation, we know transportation is oftentimes a barrier. When you look at rural areas, they're not compact and they're not contiguous. They're spread out, and you have geography being a barrier, but bringing people together, allowing them to bring their voices and their information to the table is important. But also when you look at programs and you think about the university and its reach, there are programs like the Lincoln Scholars Program, for instance, growing your own, trying to make sure that people stay in those rural areas and educating students to stay in those areas as opposed to leaving and going to other places after graduation. And so giving them a voice, putting them on committees and boards, and when programs are started in the communities, don't just start them without the voice of local people, but bringing them to the table and bringing them in as part of the process.
Yeah, I really appreciate your perspective, Dr. Baker, especially when you talked about the local levels and making sure that we, really partner with the local level, because one of the differences on our rural communities, because as I've traveled the state, I've heard people say, it's not a cookie cutter approach. You might look at some of the larger metropolitan areas, again, same issues perhaps, but the solutions will look very different, and we have to have the voices of those from those communities leading the way. Dr. Vore, did you want to jump in on this question at all?
Yeah,
Any
no,
thoughts?
I think one of the great opportunities in rural communities is the fact that as we think through, as Dr. Giles and Dr. Baker said, these, hyper-local solutions, it's actually possible to get that information and get people there. I think one of these sort of great treats as you sort of travel across, the rural communities, where, the idea that we would need a meeting in a week with the superintendent of schools and the mayor and the hospital CEOs, that would be impossible in our bigger cities. And, I think one of these sort of great examples is that that's possible for dinner sometimes because people have deep personal relationships. And, in the years, especially in the last 7 years where I have kind of traveled across different rural communities, just the sense of commitment to sort of every aspect of that, that we go to the same schools and go to the same hospital, and trying to put those things together, there isn't a commitment to do that. But often, even though there's a commitment, there isn't some of the more specific skills that I think we have the luxury of having in some bigger communities. And one of the ways that we've been trying really hard with our Rural Health Summit partnerships is understanding, what gaps are there. To your point, that it's not a cookie cutter approach because every rural community has unique needs and unique assets. And that although there may be many problems, what problems can we work together because of what we already have, and where do we need help? And trying to sort of incorporate ways, and I think we saw that really powerfully during COVID, right? So how do you access, some of this data? Okay, we need supplies, and really thinking through more regional approaches where one particular rural community may have certain really incredible things. Well, how can they partner with a rural community nearby? How can we create sort of bigger advantages? And then understanding, well, in what areas can we bring the best evidence possible for impact? And some of that means, well, we got to know what the lived experience of those individuals are, because even if it's a best practice in Chicago or Boston, it might have no way to be applied to places like Hillsborough, Illinois. But if you tell and show and explain that best practice, well, it's like, oh, parts 3 or 5 of that really make sense in our community. But there might be another program where elements 1 and 2 make sense. And to be able to put that all together, and there's possibility in that. I spoke earlier about the lack of sort of larger philanthropic investment. But one of the really powerful things in rural communities is community foundations, and how community foundations are also often a hub that bring different parts of these different locations together. The challenge is that the big foundations sort of nationally, and sort of during some work that's been done by Alan Smart and others, that even though 20% of America's population live in rural communities, of the largest 100 funders nationally, only 5.4% of that money is invested in rural communities. And so thinking through that of how do we sort of declare that, yes, the problems of our rural communities are problems of the entire country, and really thinking through deeper and bigger investment, both statewide and across the United States of America.
Absolutely. And I think one of the key phrases that you used that's so important is thinking about the unique assets of our rural communities and really taking an asset versus a deficit-based approach, like thinking about and being able to lift up the voices of communities around all the wonderful, aspects of our rural communities across the state of Illinois. And just like any community, there's still things that we need to improve, but there are so many assets, and the people being the wisdom in those communities to help us understand that. Dr. Giles, I'm going to move to you for our third question because our report, this is something you've kind of talked about a little bit already today. Our reports demonstrated that the disparities in rural areas are really similar to our underserved urban areas. So we've established that in your first response. You talked a lot about that. But what ways can the state partner both in Chicago and downstate to create deeper alliances to address these disparities? Because as you said, those coalitions are the way that we can do this work. What do we need to be thinking about how those alliances can go even deeper?
Yeah, so thanks for that. And I think there are two things. And again, you have to realize I look at this as an epidemiologist, right? So again, I think number one, I would love to see more hyperlocal data. I think, we in Chicago run the Chicago Health Atlas, which for people who don't know, provides data for all 77 communities in Chicago, data at the census and zip code. We should be expanding that atlas statewide, and that's sort of a huge opportunity. So I think, and that sort of helps with the data transparency issue. That would be great. But I also think as we're thinking about all of this work, given the commonalities, I do wonder, could we see much more investment in local communities, given what we're seeing in terms of the disparity? And so thinking about at the state level, having an investment in this. And then the third, I think, really important area that for me, that's part of this is, and I'm going to go back to, could we have local coalitions? And I will say, the reason I bring this up is because when I was at the Centers for Disease Control and Prevention, we had a program there called Partnership for Healthier Communities, but it was, a coalition approach that included community-based organizations, academic institutions, which I think really help in terms of, what is the evidence? What does the evidence base tell us? I agree totally with, of course, with Dr. Vorha when he mentioned, yes, we may need to tailor those evidence-based interventions, but I think we need to start with what is the evidence base. And I think academic institutions and the partnership with academic institutions, I think is really important as part of this. So community-based organizations, academic institutions, and then to me, having local, for a lot of the health issues, having local health departments being part of that as well. And that to me is a great and really powerful triad as we think about this work. And again, I love what you mentioned earlier about an asset-based approach, but hearing from local communities about what's working, et cetera. And I think that is a really strong recipe for success. And it's going to look very different in rural parts of the state compared to what it looks like in city of Chicago, in Inglewood, or whatever. The other thing that I did want to, and I want to pick up on something that Dr. Baker mentioned, and this is about pipelines. And, I think we also need to do a better job in Illinois of sort of having pipelines to higher education and sort of investment in that. And then, one of the things I have been struck by in the school is when students have experience, when they're working in the local health department, et cetera, they're frequently staying at that local health department. So, really thinking about sort of how we can create pipelines, but retain, people, our students, our graduates here in the state of Illinois, I think is really important as well. And I will say our graduates are all over the state. They're not just in Chicago, Cook County, but they're all over. But I think those are some really important themes as we move forward.
Well, I can say that Governor Pritzker and I certainly want the students to graduate and stay right here in the state of Illinois. So thank you for saying that. That is definitely the goal. But I want to turn to you, Dr. Baker, to answer the same question about some of the other ways that we can create deeper alliances, Chicago, downstate, to address these disparities. What are your thoughts on that same question?
Well, we know the social determinants of health are real in terms of just trying to figure out what we need to do in communities. And we've seen that. And when you look at some of the transformation dollars that the Department of Healthcare and Family Services has in communities today, those dollars are going to be spent to really transform those communities at the local level. And I think there needs to be more programming such as that again, one size does not fit all. A program that may be working in the Metro East area, you may need to tweak that. And these transformation dollars are going to be just those dollars to do that. So I'm excited to see the outcome and the data that comes behind some of those transformation dollars that are getting ready to go into the community. So they're collaboratives. And so there are health departments working with hospitals and working with FQHCs and working with the university. So groups of people that are working together in local areas, trying to transform those communities. And those collaboratives, many of them just started. I think several grants went out just about 6 or 7 months ago. And I think there are a few that are getting ready to go out. These are large sums of money. And this is something that should be transformative. The goal is to transform these communities in such ways that you don't have to say, well, Medicaid only pays for this, or Medicaid will not allow this, but really to give this money to these communities, sit around with people that work at the local level and try to come up with some real programs based upon the data that will support healthcare outcomes in those communities. And we know that healthcare means more than just health. It means economic development. It means making sure that there's safe housing. And so looking at the whole person, the whole family in those communities is what this whole transformation is supposed to be about. And I'm excited about that. And I know the university is SIU as a system will be part of that in many of these areas, the School of Medicine and other parts of the university, to really work with those communities and those leaders in the community. And not only at the top levels, but from the moms and dads that are taking their kids to school to bringing in technology as a part of the system as well.
Well, Dr. Baker, you're so right that these issues are all interconnected. And when we talk about health, what that really means. I mean, I know all of you were struck by the news that came out this week around COVID's impact on life expectancy, and specifically for Black and Brown communities. And we know that for rural communities, there's data as well, I'm sure. But and Dr. Vora, I'm going to have you jump in on this question, but I've heard Dr. Giles, Dr. Baker talk about data, and need for more hyper-local data. Does the data exist? Or are there barriers to getting the data that's needed to be able to make those same kind of conclusions like we saw with life expectancy in the city of Chicago this week? Do we have the information we need? Are there barriers to getting the information we need? And it sounds like I'm hearing both of you say that these coalitions can help with that, or even the partnership between SIU, Paul Simon Institute, and UIC School of Public Health. So I'd love for you to talk about the question about what do we need to do to create deeper alliances, state and downstate, Chicago downstate, what can the state do? But also touch a little bit on that question of data. And if either of you want to come back on that before I get to our last question, please do. Dr. Vorha?
We do struggle with data in rural communities. And part of it is that some of that stuff gets reported up, to bigger systems. But there isn't a way to sort of bring that back down to say, well, this is what this data means in these communities. And when we look at the biggest data sets across, 500, cities initiative that comes sort of federally, well, you're not going to get that from Junction, Illinois, or, places like even Alton, Illinois, that really have important information that they can use to help their own community. And I think some of those efforts is how do we incentivize even university partners to do more of that primary data collection themselves? And right now, those funding streams just aren't available. I think what we often talk about in our work at SIU and specifically in our Department of Population Science and Policy is that data means two things. It means numbers and stories, because you can get so much information from the stories that people share. And there's a lot of rich, not to get too technical about it, but the qualitative data that brings. And sharing data in numbers and stories often, I think, is one of the best ways to sort of bring rural and urban communities together. I think one of the things that I often try to push back on is when we say that there's the rural-urban divide. Why does there have to be a divide? And the term of art that I'm like to use much more now is that, well, we all live across a rural and urban continuum, right? There are big cities and small cities. There are, rural areas, and then there are even frontier areas. And we can all learn from the stories that people face. And when we're talking about things that are very simple, like the education of their children, the health of their loved ones, the isolation of maybe the most elderly in those communities, then we see that the stories are very similar. But then understanding from that story, well, to Dr. Baker's point about transportation, well, there is no way to get from my community to the hospital because the Uber and Lyft isn't there, and there's no bus system, and there's no subway. And so, as you put it out, the solutions can be different. And I think ways in which groups like that can share stories, I think is really powerful. We have the the real privilege of having often Institute of Politics from the University of Chicago interns come work with our department every year. And often they're from Chicago or even bigger cities. And for them to experience the rural communities, and I think we heard that often from our legislators and governmental officials, that there's a sense of what rural means. But once they travel, or even when rural folks travel up to urban areas and see some of the challenges there, and I think really sort of that continuum is what we need to do and share more of those stories to help create and understand the disparities and then come up with the unique solutions for each of our communities.
And I would add to that, as we started this work with Senator Paul Simon many years ago, and one of the things that he always talked about was the fact that as much as we are different, we are have so much in common in terms of the solutions to the problems. We may have to come at the problems differently in terms of addressing them. They may be local, but many of our issues are very similar in context. The issues, as you mentioned, Dr. Vora, with transportation. There are transportation issues oftentimes in urban areas where people don't want to go in certain areas because maybe there's fear of different things. They may not want to go in a particular area, but in a rural area where there is no transportation. But in terms of working together with individuals at the local area, public-private partnerships. When we talk about economic development, growing your own, maybe there's a person that will become that transportation provider. And I think those are some of the kinds of things that will hopefully come out of this transformation. You may not have a transportation provider. Well, maybe there's an entrepreneur in that community that becomes the transportation provider in that company, in that community. And so finding out and having the data to say, these are the pockets of possibilities. These are the things that this particular community needs. And how can we get them to that point? And there's an Office of Innovation on the campus of SIU in Carbondale, and that's what they do. They work with entrepreneurs to help to build capacity in those communities and working with the local workforce investment boards. And so bringing together entities like that will really help us to get to, especially if we have the data to drive the decision making, will help us to come up with some of the solutions for those areas.
Absolutely. And, both of you just talked about in terms of these solutions and what's needed. I come back to something you said, Dr. Vora, about this sense of what rural means, and it's not just a sense, it's a stereotype. There are stereotypes about rural communities, and I think about why it is so important when we all travel, or what you said, Dr. Baker, about being more alike than different. There's a sense that our rural communities are monolithic. There's a sense that, as I'm traveling the state talking about agricultural equity and food insecurity, that there's no food insecurity in rural communities because, well, aren't there lots of farms and that there's no food insecurity? But we know that that's not the case. Or education, as you talked about, these educational pathways and this pipeline. We're doing a tour on our state institutions of higher education, and we had to totally make sure that when we talk about equity has to include our rural communities, because some of those same barriers exist. People don't think people of color are in our rural communities. So there's lots of things that people have a mindset about what do our rural communities look like. And I think I love the idea of the storytelling, because the voices of our rural communities are so powerful to give a fuller picture of, and yes, we need data, but the sort of, again, qualitative data of the stories is also very helpful for us to shift that mindset that every community in our rural parts of our state are the same. And that, they each have their own richness and diversity, and we need to tap into that as we think about solutions. I think we have time for one more question, and I'm going to actually open the floor to all three of you in whichever order you want to go. What really makes right now, as we think about 2 years of this pandemic and all the different issues, right now, what makes this an optimal time to really consider changing the way that things have always been done to improve opportunity in rural communities? Because some might say, well, right now, it's been really challenging, but I think that there's a real moment of opportunity to do the kinds of things that each of you has been talking about. And as the chair of the Governor's Rural Affairs Council, this is a question that I'm very interested in hearing your response. So why is this the right time to start changing the way things have been done to really create more opportunity in our rural communities? Who wants to start? Dr. Giles, you look like you're kind of, that question got you. So how about you kick us off?
It's a great question. Thanks for that. I was going to wait for my other colleagues, but I'll take a first step. I think one is that, we have been through a horrific 2 years with the pandemic, and it's all impacted us in so many ways. But I think, we are now thinking about sort of how do we build back better? And how do we create healthier communities? Not just how do we get back to normal, but I would argue because of the disparities, right, we don't want to go back, we want to go forward. And so how do we do that? We also are seeing a lot of resources coming down from the federal government. And so I guess my urgency with all of this is, given the amount of resources that are going to state and local health departments for public health and in infrastructure and other things, this is our time really to think comprehensively about what we can do to impact. And I love this continuum, right, of rural or continuum of communities that we need to be thinking about. So to me, because we've got so many resources coming forward that are much needed, I would argue, to me, this is why this is the time to do this. And I do think communities are hungry. They want to do this. They want investment. And so for me, this is why this is a prime time to do this.
Yes, to add to that, I absolutely think the time is now. I think communities are poised for this. They're positioned. I think communities are working better together than they ever have been before. I think at the state and local level, there's much conversation going on. When I look at state agencies, across state agencies, I see more and more collaboration at that level. I see it at the administrative level as well. When you look at the amount of money that's coming into communities, now is the time for communities to get together, to start planning together. And I think a lot of that is happening. And then when we look at the fact that when we know better, we do better. I think now we know. Many of us have talked over the years about the fact that the disparities existed, but now we know. COVID has shed a light on something that has been profoundly talked about over the years. It's been talked about at an anecdotal level, but now we have the science and the data to prove that we know what happens to Black and brown children. We know that they were behind the 8 ball oftentimes in schools, but we know now what happened when they didn't have broadband in their homes and they couldn't do their work and they had to get on a bus and ride to a hot spot to be able to get onto an internet connection. We know about food deserts in certain communities. We know. And so now that we know and we have resources coming in, now is the time. We have a constellation of different federal and state programs that we can avail ourselves to or avail communities to. And I think academic institutions such as both of the institutions represented here today, we've done a lot of research and we've done a lot of discussion about this. I think we have the backdrop, and I think the time is now.
Yeah, no, I think it was Winston Churchill, right? Never let a crisis go to waste. And I think this is our extreme opportunity where we are having these conversations that infrastructure means people, buildings, it means designing the communities of the present and future. We know through Dr. Baker's point about, right, it's about coordination. There are so many incredible programs, but often just people don't know about them. And they work in often these different areas in which if we can figure out how to coordinate them. And then because of this sort of passion and energy around equity, that was a term that I think we, even a few years ago, we had to sort of take so much time to explain, but we know how important the idea of equity is. Now let's figure out how to operationalize that health equity and make sure that every resident in a community across the state has equitable solutions, that's really in there for all Illinoisans.
Well, that was a wonderful way to kind of close out this conversation. I heard a word that came up in really all of your responses in some form or another. Dr. Giles, you talked about not how do we get back to normal, but how do we think comprehensively to do better. And Dr. Baker, you said when we know better, we do better. And then Dr. Vora, you talked about this better coordination and taking this energy we have around equity to do better with operationalizing health equity. And so I kind of close out this conversation today with this concept of we can and we must do better. Thank you, Dr. Giles, Dr. Vora, and Dr. Baker for such an insightful conversation. I really just appreciate your efforts to highlight the innovative programs and movements that are happening in Illinois' rural communities. And we know that these communities face significant challenges. We know that underserved communities are having a harder time recovering from the impact of COVID-19. But we also know of the assets. And we know that there are people who are really making a difference in their communities, and that as many issues that this pandemic has shed light on, it has also provided an opportunity for investment and for action and the ability to do better. Illinois is a large, diverse state where lived experiences of residents in urban and rural areas often overlapped, as we talked about. And we can see how in the disparities impact both regions, that conversations like this one bring us closer to addressing the gaps and promoting health equity for all. As we heard, people are ready for a change and they want to solve problems, and we can explore innovative partnerships and develop strong links between healthcare, public health, and government that are needed to do just that. So I really believe that Illinois can be a national leader in creating livable, healthy, happy rural communities. And as chair of the Governor's Rural Affairs Council, I'm committed to that mission. I look forward to taking the lessons learned in this conversation back to the council as we continue our efforts. So thank you all for your hard work on the COVID-19 and Rural Health series. Dr. Vora, where does the Rural Health Summit go from here?
Well, thank you so much, Lieutenant Governor Stratton, for moderating this special session. Thank you to Dr. Baker, Dr. Giles, and those our friends at the Center for Rural Health and Social Service Development for this incredible partnership. We couldn't have done it without all of those that participated to really think through on how we continue to work on rural health issues. And so although this is the end of the Rural Health Summit and COVID-19 series, we'll still be having different and unique conversations on how we can improve rural health communities. The next webinar will actually come on May 19th, where we have the privilege of having a conversation with former Deputy Secretary of Health and Human Services, Eric Hargan, who will be speaking around a webinar around innovations in rural healthcare. So thank you to you all for your time, your attention. Thanks again, Lieutenant Governor. And we look forward to all the partnerships in the future to improve all of Illinois' communities, especially those in our rural areas across the state. Thank you so much.
Thank you.